This conference will now be recorded.
Good afternoon, everybody. Thanks for joining us for our Friday Allscripts training session. So 2 bits of good news for today. The first is that we made it to Friday. And the second bit of good news is that we made it through assessment and plan yesterday. So we're going to go over a few shortcuts. We're going to go over the documentation process and assessment and plan. We're going to go through our artificial intelligence, that AI feature that I've been telling you guys about, and some other tips and tricks as we go through our scheduling, as we go through our training today. So congratulations, 2 wins, made it through the week and made it through assessment and plan. So great job. So here we are on our home screen on our desktop. We are going to launch our login for our cloud. We're going to do that by double clicking here. And we'll log in. We have our mountain folder that we're going to click on and then click on our clinical module. That's going to get us connected to our green screen where we can log in for our application. For those of you who have not done so already, I want to remind you that you can create that, that shortcut that I have on my desktop very easily. You can do that by clicking on our line here where it has Internet Explorer. We can drag our address here onto our desktop to create that. We also have the opportunity to right-click on our icon, and then we can pin it to our taskbar. That will allow us to have it down here on our taskbar so we could just launch that icon, that Internet Explorer icon. Some of the reason that is really helpful is to ensure that you are launching and using Internet Explorer when you log in. The system is finicky. It doesn't like Chrome. It doesn't like Firefox. It doesn't like Safari. It only likes Internet Explorer, and so in order to make sure that you launch it, because that's not usually the browser that we use anymore, putting that shortcut on your desktop or pinning it to your taskbar can be really helpful to ensure that you're opening it with the right browser. So if you haven't done that yet, make sure that you do that. It will help streamline your process and then make your sign-in process a little bit easier. So here we are. We are in our Allscripts desktop function here, where I'm going to look up our patient. I'm going to click on patient. Like we talked about yesterday, we could type in our patient search name, click on our search training patients and hit search, and our patient would come up. But because we also want to learn shortcuts as we go through this process, if I want to see my most recent patients, I can click on recent, and all the patients that I've recently looked at over the last few weeks are listed here. And so I can launch my test patient just by double clicking it. I'm going to add to our encounter that we have been building our assessment and plan on. So I'm going to launch our 410 encounter visit. However, if this was a new patient or this is a patient that's being seen in the office, we're going to make sure that we want the encounter date to be the same day as the visit. But because we're training, and I'm going to launch this 410 visit here. So here we are on the face sheet. Some things that I want to remind us of, just so that we can continue to get used to what we're looking at. Here on the left column, here on the face sheet, we have our patient's history. If you recall, when we did our initial history, the past medical history that we added we added arthritis and we added fibromyalgia that the patient reported on their problem list from our intake form. These other 4 diagnoses that are listed here are things that we have added in our assessment and plan as we've gone through some of these test encounters. And so what I want you to see here is that as we add diagnoses to our encounters, it updates our problem list for us right here. And so that's positive because we'll be able to draw those diagnoses into our assessment plan for our follow-up visits, which is really helpful. But it's also important that we recognize that as we are finalizing our care with a patient, if we no longer are treating them for maybe their rotator cuff injury, but maybe we're now treating them for a fracture of their ulna, like we have listed here, we would want to make sure that anything that we're not treating for them, we're resolving in our intake process. And so that we would do that through our histories and resolve them, make sure that we didn't have them listed anymore. So I wanted to call that out to you. Again, here we have our encounters. This is going to be where we see our chart documents. We have all of the encounters that we've closed previously listed in our office visits. We would see our op reports here, our MRI reports, anything we had scanned and assigned to the patient's chart, any of our patient correspondence through messaging, of which we'll talk about in future trainings. All that's going to be here to view documents. Because we haven't closed our encounter today, we have that under the Open Encounters tab. And if we wanted to see what we had built today, we could double click on that and view it. In our middle third on the right side, we have our medications. Those are our active medications, previous, and the ones that we've ordered for the patient here in our medication module. And then we have our orders. Yesterday, we talked about what this looks like here. We had we went through the things that we entered 2 days ago and the day before. So we did the 14th and the 15th. You can see that all of those as we went through our assessment and plan. We added all of these items. We're getting an extensive list, as you can see here. And so in order to have a better view of that, we can click on our maximize screen. It will take us to a full view here. We can see what we ordered on day 1 and day 2 of our assessment and plan. But we could also then take a look at yesterday's and see what we entered for our part 3 of assessment and plan listed here. So that we could see what was ordered. If we wanted to see what this looked like, we could always double click on it. Double clicking on it takes us to the view box here where we could see the order. Our comments are included. We could toggle back and forth from the orders that we have listed here from the ones that we put in yesterday, but then also the ones that we put in previously if we wanted to see what those look like. I'm going to close out on that screen. It will continue to take me to that full view of my orders. The piece that I want to call out today that was new to our workflow is this future orders folder. When we ordered our surgery yesterday, our surgeries we did, I'm going to expand our caret. We're going to see the procedures that we ordered yesterday listed here in our future orders. Having it listed as our future orders should be our flag that says, hey, this patient has surgery coming up. And so we can keep an eye on that there. We would also put in future orders any of our visco or injection series that we're doing in the office. If it's something that we're doing out of the office, we are not going to put that in our future orders. We're only going to put future orders for things that we are going to bill for in the future, bill for in OCC. That those are the only things that we're going to put in our future orders. So I'm going to go back to my original view, the one that launches when I open up my patient. I'm going to do that by minimizing my screen, clicking on this little double screen icon here will take me back to the view that I'm used to seeing. Again, you'll see that future appointments, those future orders, are listed here in the future folder. So one of the questions that we had yesterday in one of our trainings was, and we called this out in our training yesterday, that once you move things over here to our future plan, we're limited to the amount of editing that we have. If we click on it and then we click our pencil, which is our edit tool, we could change our date here if we wanted to, but we're not able to change the comments. And so we had some feedback from one of our providers who has been exploring in the system, and they found a workaround, and I want to share that with you. So if we're here in our future plans, we want to make an additional edit. Maybe we say, oh, I want to make sure that I have this assistant with me, or oh, I forgot to list specials or something like that. Maybe call something out specific. We're going to click on the order. We're going to choose include. That's going to change it. You'll see it disappeared here from our future orders. If we look over here in our current plan, you'll see that it moves back over here. If we double click on that, we're able to edit our comments here. And we could say, maybe attention to our metal allergy. Or we could call out maybe an anesthesia history concern, and click OK here. And then we would change it back to our future order, change it back to our future date, which we had for the 30th, and then click OK. You'll see then it moves back over to our future plans. So to walk through that process again, if we've already ordered it, we've moved it over to our future plan, and we say, oh, I need to make an edit, we can click on the procedure, click include. It moves it back over to our current plan. We find it in our current plans here, double click on it, add our new note, change our date again to a future date that we expect that the surgery will be on or around, and click OK. And then it moves it back over to our future plans. So the reason that we're putting it into future plans is because we recognize that there's going to be some internal workflow that we need to work on. Our surgery schedulers need to call and go through the surgery scheduling process. We're going to go through the surgery scheduling process in a different training session. So I don't want you to think that I've forgotten about that. This is only part one of that surgery scheduling process. There is a follow-up portion where we could use it in a queue. We're going to use a queue to identify which surgeries need to be scheduled, and then be able to track our progress in surgery scheduling in that process. But for our ordering purposes, we're going to make sure that it comes into our future orders right here with the workflow that we just recognized. So the other thing that I want to talk to you guys about and show you is where to document our actual assessment and plan, right? So in our workflow that we've gone over in the last 3 days, we've really talked about what it looks like to populate the super bill more than anything, right? That we're going through all of these items, we're moving them down into our current plan so that we can identify what we did that day, a lot of which are for billing purposes, right? So we want to make sure that we're capturing that so that we are that we're billing and getting paid for the things that we're doing, right? But you know, a core purpose of the assessment and plan is to record the plan based on the diagnosis. And so in order to do that, we are going to double click on the diagnosis that we have listed here. When we do that, we have two boxes that are going to populate. As a reminder, this is the same screen that if we use our edit pencil here, this is where we chose our specific diagnosis here. But here in our problem screen, we have our problem story, and then we have today's impression. Our problem story, we can record the patient's story. Here. We can tell we do want to recognize we are capturing a lot of that in our dynamic HPI when we're doing our intake. But if we aren't recording it in our HPI, there's some portions of the patient story that we want to be able to capture in the plan and make sure that we have record of that. And so we're going to put that here in the problem story. I'll show you what that looks like in our patient's document in the note in just a minute. Here in our impression, we could dictate with our voice recognition system the information that we want for our plan listed here. We could also use our auto-replace text or our memorized phrases, and we can drop in some memorized phrases for our assessment and plan of things that we wanted to record here. We could also type here as well. So we have the option of using our auto replace text. We can use our dictaphone, and we can also type in these boxes here to record our plan for this diagnosis. Once we hit OK, you'll see that we have a brief information behind our diagnosis. If we have more than one diagnosis, we're going to want to record the plan for each diagnosis here. We're going to put our shoulder pain story if we have one, and then today's impression for shoulder pain. And then maybe I also drop in some auto-replace text that I've pre-populated and saved to my memorized phrases, and click OK. Then you'll see again, it does put a brief summary right after the diagnosis. So what does that look like in our patient's documentation? If we go here to our history and physical, we click on that link. As a sidebar, I fully understand that history and physical is a really weird title for viewing our patient's note, but yeah, that's what Allscripts has called it. So I apologize for that. I know it doesn't make a whole lot of sense. But here in our history and physical, we can look to see what our assessment and plan looks like. And you'll see that our story for our rotator cuff tear is listed here. Our impression that we put in that box is right here. Then we follow all of the current plans, our surgery that we ordered, that's in there. And then we have our shoulder pain with our story and our impression that we completed by dictating, typing, or using our auto-replace text here. And so that's how we're going to record our actual plan for our patients. So again, in assessment, we're gonna double click on our diagnosis, and then it's gonna launch that problem box that we can record the story and the impression, and click OK. So another feature we've been talking about with a lot of that have been the answers to some of your questions as you guys are asking them in the chat through our assessment and plan training has been, how do I make this easier? Do I have to add an injection every time? Do I have to add x-rays every time I see this diagnosis? And the answer is no. We have built into Allscripts, we have what's an AI feature, an artificial intelligence feature that's built into Allscripts. And what this does, it's under the Smart List. And so to get there, again, I'm here in Assessment and Plan. And there's a green bar next to the right margin that has a light bulb with a double caret. If you click that double caret, the Smart List will appear. What the Smart List does is that it learns your tenancies, so by diagnosis. So it's going to learn as you go, as you enter the information. It's going to start remembering that when we have a non-traumatic complete tear of the right rotator cuff, I usually do an injection, I order PT, I order an MRI, and order x-rays, right? And so the system's going to learn our tendencies and then offer those suggestions up here in our Smart List. And so once we choose a diagnosis, once the system learns what we do, we would be able to come up here and we would be able to click boxes that would include injection, ordering PT, MRI, x-rays, and all of that would be up here in our Smart List that we could just click or unclick boxes as those assessment and plan items applied to that specific encounter. Some nuances to this that we should know. The first thing is that Allscripts says it takes about 10 encounters for it to start learning what you do for the diagnosis. It takes 30 encounters for them to know, to really drill that in and be more precise in your tendencies. And so keep that in mind when you're building these. Something to note that they do indicate that it does pull from our and learns in our test patients. So if you want to start going through your diagnoses for patients and start doing what you think you're going to normally do in an order through your assessment and plan, it can start learning from you now, and you can start building this Smart List by diagnosis. Another nuance to call out is that it is specific to the diagnosis that you choose, all the way to the final digit here. So we have our non-traumatic complete tear of right rotator cuff, and that is going to come up every time I choose that M75.121. It's going to come up. But when I choose a left rotator cuff, then my tendencies are not going to be learned until I do 10 of those. So keep that in mind. Where it gets really difficult is when we start getting into digits and proximal digits and getting really specific in hands and feet. So I apologize to our foot and hand specialists. It's going to take more time for it to learn what you're doing because the diagnoses are so specific, but this will be a great enhancement to your workflow as the system learns what you do, and you can take full advantage of that Smart List. So look forward to that as you get more and more experience. Another great opportunity that we have is that you'll see we have, this is based on my tendencies, that's clicked green right now, and that's going to be based on what I do. So when I choose this diagnosis, this is what my history tells me that I normally order. However, we also have this option of based on the entire practice. And if we click the based on entire practice option, it's not only going to pull from what I order under that diagnosis, but it's going to pull from what all of OCC orders in that diagnosis. And so that could be helpful, especially if it's something that we don't normally see, or if we're seeing something for a partner who might be out of the office, that this is helpful to be able to pull some assessment and plan tendencies and orders of what's normally ordered across the entire OCC practice. So again, some enhancements to look forward to. It's going to remind you that you normally do an injection, or you normally order PT, you normally order a boot, whatever that is. It's going to remember the items that you're clicking over here in your short list, and then prompt you here on your smart list, and you can choose from your smart list. So that's what we have for our smart list, and something to look forward to as our system learns and grows with us. That is what I have for today. If you have any questions, go ahead and throw those in the chat. I will answer those as we continue our 30 minutes. I do want to make sure that I share with you, we are not going to have Allscripts training on Monday. We will return to our training on Tuesday and be able to jump in to learning more about Allscripts and the workflows and some of the bells and whistles that we haven't been able to go through in our intake and documentation process, but no training on Monday. So look for your look in your email today. I'll also send a reminder to you that there's not training on Monday. You'll also get copies of the training from sessions 1 through 4 for our assessment and plan tonight in your email. So take a look at that as well. We do have a question. It says, is it better to put the story or patient history under the reason for visit note so it shows up under the PHI or under the story section, or does it matter? Good question. I think so. When we populate those when we go into our reason for visit and we launch our HPI, and we fill out these top items before we get to the line, that's going to automatically generate part of our story. We also can do a note here and add the additional HPI information that we want, and capture all of the HPI there. The assessment and plan, choosing to add the patient's story up here, that is completely discretional if there's additional information. If you like it to appear there versus having to dig through the HPI information, you could certainly do that. The only thing that I would caution you is to make sure that those two stories, if you choose to put it in the problem story section here under the problem, that you are making sure that it is the same as our HPI is capturing, so that there's not any conflict in our recording in our patient's chart is the only thing that I would caution. So again, thank you guys for joining us today. Please reach out if you have any questions. Join me on Tuesday and we'll learn more about our Allscripts process. Have a great weekend and see you guys on Tuesday.